Recording. Yay. Can you see me?
Yeah, yeah.
Yeah, perfect. Trying a new kind of format here. We'll see if we like it or not. But it might be a little bit more interactive. So, yeah, we'll begin today and just allow people to join us just with a simple chant to Lord Dhanvantri as we have been doing. Again, remembering that Lord Dhanvantri is that inner healer within ourselves, within each other, and that energy that we call upon to allow us to evoke that wisdom within and that wisdom of Ayurveda. So just taking a moment to find your seat. As everyone's joining, we are coming into a chant with Lord Dhanvantri. So just taking a beautiful seat, feeling all of the contact points of your body to your chair or wherever you're seated. Noticing your breath, the rise and fall, the equal inhales and exhales. Feeling the warmth of your hands pressing together. And I actually have a statue of Lord Dhanvantri here. So just wanted to show you guys. So beautiful. Um, and this is the energy that we are tuning into to begin our practice, calling it through the ancient timelines, through the mantra, the vibration, the energy, the frequency. Setting an intention for today's class of presence, of allowing the wisdom to land in the center of the heart, from which you can then take it outwards into the world. As we settle in, allow this intention to ride the river of the mantra, remembering the mantra as Om Dhanvantri Murtaye Namaha. I bow to the wisdom within the lineage of Ayurveda. Exhaling completely. Inhaling. Om Dhanvantri Murtaye Namaha. 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 Om Shanti, Shanti, Shanti. Peace, peace, peace. Welcome, everybody. How's everybody's week been? Good. I can't see everyone for some reason. Let me see why. There we go. And now I can. Hi. So much nicer when I can see everybody's beautiful smiley faces. So welcome everybody. We are going to complete the anatomy and physiology module today and also review the homework and do a review of what we did last week, simply to continue to layer on. And that's what this program is about. It's about layering on uh, again and again that wisdom of the doshas, the subdoshas, the elements, the gunas, the qualities, to the point where it becomes such a second nature that you don't think about them. It's something that you see and something that you feel. So last week, did you guys enjoy the class last week? Has everybody watched the recording? Yeah. It's almost like you're demystifying what Ayurveda is simply by understanding the elements. It's not complex, although we can overcomplicate it. It is a simple understanding of the relationship of the qualities of the elements, the gunas, and the qualities of the elements and how the elements work within the doshas, and then within the subdoshas, and then within the dhatus and the tissues, and then within the shrotas and the channels of the body. So once we understand this, we can really see and map out the path of disease in the body. So this is or what we call accumulation, overflow, and relocation, manifestation, and diversification of um, an excess or deficiency, mainly an excess of what is accumulating in the body. And once we can bring balance into it, then we understand how we can help ourselves and help others in the healing process. The body is so wise, and we have to remember that. Yes, we are healers as Ayurvedic practitioners, but essentially we're giving others the tools and creating the environment for the body to heal itself, because we have to always remember that wisdom lives within the cells of our body, and each other's body. So essentially, as Ayurvedic practitioners, it's not that we're healers as such, as we are giving the tools and the correct balancing techniques and practices and herbs and elemental qualities to bring the body back into balance for it to heal itself. And when we remember that wisdom, we remember that we are whole, essentially. And remember, if we go back to the philosophy module of Ayurveda, that tells us, dis-ease is us forgetting our true nature. Our true nature is already whole, as already spirit. And that's where the relationship lies in the philosophy. So let's begin. I just want to kind of go over, the gunas again. Well, I'm not going to spend too much time on review, but remembering we have these 20 gunas, or 10 opposing opposites: heavy, light, cold, hot, dry, oily, dull, sharp, rough, smooth, dense, liquid, hard, soft, static, mobile, gross, subtle, sticky, clear. Why is this important? If you see and look at the homework that's coming up, if you haven't already done so, one of the tasks in there is to think about these qualities in your body right now. Do you feel heavy or do you feel light? Do you feel hot or do you feel cold? Do you have dryness or is there an oiliness? Are you feeling dull or are you feeling sharp in mind and in spirit? Is there a roughness or a smoothness to your skin or to your tactile sensation? Would you say that you have a density or you feel fluid, like a liquid? Is there a hard or soft element to you? Do you feel like you've got static, like no motion in the body, or do you feel mobile in the mind? Gross, subtle, sticky, clear. So these things are going to give us clues as to what dosha is in excess, what dosha is manifesting, what element is manifesting. So the gunas are really allowing us to understand the elemental qualities in our body, because each one of the elements have a quality. And we saw that when we looked at each one of these here: hot, cold, moist and dry. You can see the dosha, and I'm just kind of flicking through these because we've already done. all of this. So once we understand each one of these, then we can come to the understanding um, that everything in nature is made up of these five great elements, and these elements are contained, or contain the qualities of nature, and they're also ideas as well. So we call them the Pancha Mahabhutas. So everybody say Pancha. Pancha means five. Maha means great, and Bhutas means elements. So the five great elements. Pancha, five. And Maha means great, and Bhutas, elements. Beautiful. So here we have the attributes of the elements, ether, air, fire, water, and earth, and the Sanskrit terms here. So part of the homework is to do your little your flip cards, which I highly recommend. You don't have to do them on Canva. You can just handwrite them. Old school, it works just as well. Although I don't know who was it that did those beautiful ones. I don't know, somebody's a graphic artist, apparently. Is that you, Haley? They were beautiful, absolutely gorgeous. And so like you can be as creative or as simple as you want with them. Don't get too caught up with it. But if that's like how you learn and how you do it whatever makes sense to you. But when we understand the Sanskrit terms, we tap into the Sanskrit has this beautiful ability for us to tap into the wisdom. So when we say the word akasha, we can feel ether, right? When we say the word vayu, we can feel air and movement. Agni, everyone say Agni, like you can feel the Agni in the Agni, right? Like it's like there is this like way that Sanskrit actually gutturally allows you to feel the meaning in the term. One of my favorite things is Dr. Ladd. So I've studied with Dr. Ladd, and I've listened. This is way back when we didn't have like MP3s, we had CDs, and I had all of his is basically the Vedas, him chanting the Ayurvedic Vedas, Ayurveda in Sanskrit. And I would just listen to them on my CD. And he has to have downloaded these somewhere, but I no longer have those CDs, but I wish I did because sometimes I just want to sit there and listen to him chant, the wisdom of Ayurveda. So that's how this wisdom was passed down. It wasn't passed down. Yes, it was passed down through the texts of the Vedas, but at first it was chanted. And so, they would chant through the Sanskrit language the wisdom of Ayurveda. So when we use these Sanskrit terms, we are using the that wisdom that we're tapping into, that ancient wisdom. And modern science is actually catching up to the idea of vibration, the idea of language being part of that healing aspect. When we say something, they say that there's three levels of sound. One is us saying it out loud. So Agni, right? The other is a whisper, Agni. And then the other one is internally saying, and so your body hears the thoughts that you are saying, the whispers, and also that loud sound of actually speaking it. So we have to never underestimate one, our thoughts in mantra, two, the whisper. I always whisper, I love you to my partner. He goes, why do you whisper it? I said, because it hits in a different way. Right. So, and I truly believe that. Like if you whisper something in someone's ear, it's hitting them in a different level. And so with these Sanskrit terms, I highly encourage you to tap into their wisdom, to chant them out loud, to say them in your mind's eye, to whisper them. Often when we do mantras, we will, and that's why when I'm chanting to Lord Dhanvantri, the last one is always very gentle because we're taking it into another layer of understanding. So, uh, a little sidetrack of like why Sanskrit is so important, doing your flashcards, and then also understanding the Sanskrit terms and why that's important in modern day. Furthermore, if you were to go and take any of the exams, say in America or and maybe in Australia, as they, um, I guess, register Ayurveda as like acupuncture or and things like that, they will require that Sanskrit knowledge. So want to make sure you're prepared for any level of testing that may come up on a, I guess, certification standpoint, or if you're wanting to work within the American standards. So this right here, again, the attributes of the elements and how we can see the relationship of those gunas. Guna means those attributes, right? For there. So for ether, cold, dry, light, subtle, liquid, mobile, penetrating, soft, smooth, and clear. So ether is the most ethereal. It's the less tactile of all of the elements. And then air, it's cold, it's dry, it's light, it's subtle, it's mobile, it's penetrating, it's rough, it's hard, it's clear. And then fire, hot, dry, light, subtle, mobile, penetrating, rough, hard, and clear. And water, cold, moist, heavy, dense, liquid, static, resistant, soft, smooth, cloudy. And then earth, cold, dry, heavy, coarse, solid, static, resistant, hard, rough, and dark. So we're moving from most etheric to most tactile, so like the most solid. And if we were to look at this on levels, you would see that. I see there's some questions here. I'm just going to look at those. Why is liquid an attribute of ether? Really good question. Uh, so um, liquid, it's more about the movement here. Sorry, I'm just going to get rid of this. So cold, dry, light, subtle, liquid. It it's also known as dry. So it's liquid in the sense of mobile, but not, it's like the like a cloud is actually liquid. That makes sense. So there's that liquid attribute in Akasha. Yeah. It's not wet. It's more gaseous, I would say. Okay. So these are the attributes here. And then just understanding that to bring balance, that idea of opposites bring balance. So if we're feeling more ether, then we want to add more water and earth, or some warmth as well. If we're feeling more fire, then we want to add the coolness. If we're feeling mobile, we want to add the static to bring it into balance if we feel that there is an excess of any one of those. So we're starting to really understand the attributes of the elements and the gunas, and then moving into the doshas, which have an understanding of the sense organs, and the organs of actions. So remembering that for earth, the sense organ is the nose. We've got the organ of action, which was like the smell, and then we've got the anus and defecation. So then we have water, where we have the tongue, and then taste. The genitals are connected to that, and we have emission. Then fire, eyes. So anything to do with pitta and eyes are very much part of fire. That's where tejas comes from. That spark in someone's eye, that passion that they bring is seen through that spark in the eye. Vision, feet, and purpose. Air, we've got skin, anything that touches the skin, hands, and manipulation. And then ether is hearing, smell, mouth, and speech. So you can see where Vata is very much connected to speech, and very much connected to air and touch and movement. So here you can kind of begin to see the relationship of the doshas to the elements. Again, we're moving through this fairly quickly because we're going to get to our next topic, which will be really reviewing the tissues. But here in tridoshic theory, dosha means fault or something that causes harm. Tridosha, there are three physiological forces that, when out of balance, cause disease. We've got vata movement, pitta metabolism and digestion, and kapha in structure. So this is your idea of tridosha theory, where vata, pitta, and kapha have these key normal functions, and when they're out of balance, then dis-ease can move into the body, the mind, and even the spirit. Again, a review of the qualities and the three doshas. We've already gone over all of this, but it's really important to understand this space so that you can constantly go back and be like, okay, vata is air and ether, pitta is mostly fire and a little bit of water, kapha, water and earth. Know those like the back of your hand, because then you can use the qualities of those and then bring balance by adding in the opposites within reason. So that is where we have headed and what we've covered so far. We've got Vata in charge of movement, creativity, and change, Pitta in charge of transformation, digestion, and intensity, and Kapha in charge of stability, nourishment, and calmness. We need all three. Not one is better than the other. Sometimes we like to label them better than the other, but it's not the case. We actually need all three. And we are all different variations of them. And again, it's more about accepting and understanding who we are and working with who we are and not against who we are. So if we know we're Vata or if we know we're Kapha, being mindful of that, accepting of that, and then bringing in the things to bring the most balance into our body, our mind, and our spirit. We went over, and I think you did this with Helena. So, all the signs of Pitta imbalance and the signs of Vata imbalance. And the more that you review this, the more it'll be easy for you to like really understand what dosha is at play. So you'll start to see, because we're going to be doing so many, I guess, case studies, and we're going to be doing so many review of pathologies that eventually you'll be able to be like, okay, you know, uh, dryness, anything to do with rough skin or constipation is often vata. So you'll know these doshic imbalances by the back of your hand by the end of this course, just through repetition and also understanding how the qualities and the elements work within doshic imbalance. Already talked about this, but the basis of treatment is to take in the opposite qualities through the five senses. Treat cold with heat, treat dryness with moistness, treat heaviness with lightness, and treat mobility with stability. It seems way too simple, but it's so important. Um, so all of this is in your slides, and I think it's also important to remember that, and I think that mixes with pitta becomes hot. So these few key rules will always help you override any kind of complex situations that arise. And I think that mixes with kapha becomes heavier, and vata is a bit trickier. So when something mixes with vata, it tends to become more mobile, but it's not always observed in the kapha body, as vata is too subtle to move a large mass. Thus, it may be observed in the mind. So we just have to be really careful. Anytime there's a vata imbalance, or anytime we've got any mobility or variation in alternating constipation and diarrhea, or any kind of high or low, or just fluctuation, we know vata is at play. And then we need to ensure that vata is first stabilized so that we can then treat the root cause of disease in the body. Any questions so far? Yep, Donna?
So in regards to mobility, and this is where I was, say 12 weeks ago, if you're laid up with an injury for say 12 weeks and you're a Vata Pitta predominantly, and you talk about mobile and stability, and I know I've got some imbalances from that. What do you do at the time you're laid up to support that?
Yeah. So I mean, it's a great question, right? So you're basically saying you know that you need that movement in your body, but you're
Yeah,
unable to move. So you have to be in a stable situation.
yeah,
So
yeah,
kind of gentle like movement that you can do. We
yeah,
sometimes think that movement has to be so big, right?
yeah,
So
yeah.
especially in the healing stages, like we
Yes.
used to teach this program called Use it. We used to go into hospitals and teach people who had cancer and hospice and things like that. Simple movement exercises that were could maybe even be like neck stretches like this or little arm movements. It could be stretching in bed. So never underestimate first the power of small movements, especially
Yeah,
when are recovering and healing,
yeah,
or if people have a massive kapha imbalance where they can't actually move out of like the just the smallest movement, like walking to the mailbox can be
yeah,
enough, right?
yeah.
So first of all, don't underestimate the power of small movements. Um,
Mhm.
the other one is visualization. So visualizing yourself moving more, even though you're not.
Yeah, yeah,
Visualization is incredibly powerful, and also breath work. So you can move energy through the body through
yeah,
visualizing the breath work through the body, which is
yeah,
incredibly powerful as
yeah.
well. So although you can't physically move your body, you can visualize your breath in your body and allow that to be the movement within your body along with the visualization.
Amazing. Thank you so much. Yeah,
I'll never forget. I used to, in my younger years, do a lot of bodybuilding, and I, and this is probably aging myself, but at this point, Arnold Schwarzenegger was Mr. Universe. And and he had this quote that he said he would visualize himself up on stage becoming Mr. Universe. And he
yes,
saw himself, winning the trophy, having the physique, doing everything. And like I that always stuck with me
yeah,
because it's like, okay. And Joe Dispenza says this as well. So does
yeah,
everyone know who Joe Dispenza is?
yeah. He's amazing.
He is amazing, right?
Yeah,
So he visualized himself, the blueprint within the body, and it's the same thing too. So
yeah,
this is the we're tapping into the same Akashic wisdom.
yeah.
What he's actually talking about is what the yogis have known for centuries. It's what's in the Yoga Hatha Pradipakika and the end chapters of it. So none of this is really new. It's just tapping into the wisdom that we've always known for the longest time. The rishis have known, and it's been available to us in the Ayurvedic wisdom.
Great. Thank you. Thank you again. Your knowledge is just amazing. I'm so grateful to be here. So grateful. Thank you.
Grateful to be here too. I'm grateful for Ayurveda. Like seriously,
Yeah.
this is it's magic. So, any other questions? No? Okay. So we'll move on to, we talked about the key locations of the doshas in the body, right? So each one of the doshas has a key location, but then each one of those also has a subdosha. So looking at the subdoshas of each of these, we can understand how we can treat the doshas more specifically and the imbalances in a greater detail. So that's what the subdoshas show us. They show us exactly how to map out the root cause of disease in the body. Now, when we're working with those subdoshas, and as you'll see the homework, it will show us, it will ask us, okay, what dhatu what dhatu is, what subdosha is it? What dhatu is it? What shrota is it? So we understand and we're mapping the path of disease in the body. So we talked a little bit about the vata subdoshas, and I gave you a little I guess, memorization tool for vata and the subdoshas. So here, um, we've got prana coming in. So remember that prana is coming in. Udana up and out. And just practice this because it will help you understand that up and out. Vyana, all around circulation. Samana, outwards to in. So the absorption, and then apana, down and out. Apana, down and out. When we practice yoga, we want to feel these directions in grounding down through the earth, reaching up through the air, circulating the breath through the body, and that samana of absorption with what you could call as Muladhara, like a bandha lock almost to create that energy in there. So, but Vata is all about the movement in the body. It's all about the nervous system. And so when we understand how that's circulating through our body and through our mind, then we can have just a greater understanding to the movement in the body. Then we went to and we kind of have this nice little picture here. But then we went to Pitta and the Pitta subdoshas. And here we have the Alachaka Pitta, which is the pupil, the Brajaka Pitta, Ranjaka Pitta, Saddaka Pitta, which is the brain and the emotional heart, and the Pachaka Pitta, the small intestines and the lower half. And this is all about your digestion of food. And so the Pitta subdosha are just such an important part of heat in the body, of digestion, of understanding each one of these. So we went through that. Then we looked at the kapha subdoshas. So here we have Bodhaka Kapha in the mouth and the tongue, Sleshaka Kapha in the joints, Pledaka Kapha in the stomach, Avalambaka Kapha in the chest and the heart and the lungs, and Tapaka Kapha in the brain and the emotional heart. So this is all about lubrication, stomach structure. Any imbalances here often treated as sluggish digestion or nausea. So this is something to keep in mind as we move forward. So we went through each one of these in details, and then we also talked about the three most important subdoshas for each of them. So for Vata, we've got Apana Vayu. For Pitta, we have Pachaka Pitta and the strength of digestion, and then the Kledaka Kapha, which protects digestion. They're all located in the digestive system, and these three are located at the home site of each of the doshas, and they are treated anytime there is a doshic disturbance, regardless of the subdosha that's involved, because we want to start with that digestive tract, because the digestive tract is most easily accessed of all of the shrotas in the body by herbal remedies and sensory therapies. Okay. And so we always want to use that digestive tract. Remember, we have a hole. I don't know if I've said this to you guys, but we have a hole in our body. Do you know where it starts? It starts in our mouth and it ends in our anus, right? So if you can understand that, like when we consume something, and that track right there, so that we've got the armor on the tongue, we've got what does a digestive system doing? How is it there? It's quite amazing to think that our mouth and our anus are like connected, and they are. And I know that sounds awful, but it's true. And so when we understand that, then we understand how important what we consume is to our overall sense of well-being in our digestive tract and how easily we can bring our body back into balance through our digestive tract if we're doing the right things, the right qualities, the right gunas, the right elemental balancing. So this is the theory of subdosas, the theory of our digestive tract. So here we started to talk about the dhatus. Do you guys remember the Rasa, Rakta, Mamsa, Medus, Asti, Meja, Shukra? Right? So this is how we were going to like start to remember. And I know it seems like yeah, I know, preschoolish, but I don't care because I think it works, right? So it's like, how else do you like get this into you? Like, and again, you're using those Sanskrit terms, so rasa, rakta, mamsa, medus, asti, maja, shukra, and understand that rasa is the plasma, rakta is the blood, mamsa is the muscle, medus is the fat tissue, asti is the bone marrow. Maja is the nervous tissue, and shukra is the reproductive tissue, all of this to lead us to ojas. And we want the most pure ojas. When I work with my prenatal patients, clients, um, Ayurveda gives us a set of things to do to prepare the ojas so that it's the most purest form of ojas so that we can reproduce in the healthiest way. So if somebody wants to fall pregnant and have a very conscious pregnancy, not that any pregnancy is unconscious because it's not, um, you know, divinity is divinity, life is life, but there is a way to ensure the healthiest ojas, the healthiest reproductive tissue through taking us through quite often you can do like a panchakarma. Both the man and the woman do a panchakarma, a full cleanse 6 months prior to trying to have a baby to ensure that you've got this like really healthy semen and ovum and reproductive tissue, and also you're producing the highest level of ojas. So you can kind of see how life can be impacted through these tissues and also our cells. So this is the production of our cells as well. This is a powerful understanding. We talked about this last week of the cycle of cellular life, the cycle of cellular life, our existence. They say that each one of the seven dhatus correlates or parallels with the universe as a whole, which also has seven planes of existence. So if we can think about that, it's quite a powerful way of understanding. So that's our review. We went in and we did look at the tissues and the elements, and I believe we ended here at ojas. Is that correct? Yeah. So we're going to look at each one of the Rasa Rakta, Mamsa Medas Asti Shukra, and look at each one of these in detail. So let's take a look here at the function of plasma. Rasa, 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 rasa. I I truly believe that we don't really give, in modern medicine, the concept of rasa a big enough play. So the function of plasma is to promote nourishment and pleasure. So the element here is the water element. And it's responsible for tissue hydration and maintaining electrolyte balance. Its location is the heart, the blood vessels, the lymphatic system, the skin, and the mucous membranes. I think we're just now starting to really, and you can see this in that the health and wellness industry, with these lymphatic like body clubs showing up. Lymphatic massage is really big now. Harmony, I think you had someone on your podcast recently in regards to lymphatic system, totally powerful. But we're understanding it really is a communication system of our body as well, like along with the fascia, the lymphatic, and if that is clogged up, then the body isn't communicating on the right level, um, and um, and so I think that this is something that we're going to understand at a higher level. So the term rasa itself means essence or sap, which is beautiful. And at the same time, it signifies beauty, joy, the pleasure of movement, like dancing. And so plasma is found throughout the body, but its primary locations are the heart, the blood vessels, the lymphatic system, the skin, the mucous membranes. So if the rasa is dried up, then our pleasure is often dried up. If our rasa is, there's this like beautiful interplay of the fullness of life and the fullness of rasa. We want to be nourished. We want to have that energy, that vitality, and enjoy acting and moving through life with fluidity. I say rasa and ojas are so closely like you begin with rasa and you end with ojas. But if your ojas is full, then it re-nourishes your rasa. So, you can see the complete cycle of it moving through all of these tissues. So you end up with this ojas. And if your ojas is is and quite often you can think of ojas as a container that holds vata, pitta, and kapha, or prana, tejas, and ojas. And if the fire is too hot, then it burns away that container. And if the air is too much, it can bust the container. So, we want to keep a thick ojas container, like and doing that, we provide the greater formation of rasa in the body. So I believe that there is a intimate relationship between rasa and ojas and that cycle of life, and to keep a quality level of rasa. So let's look at rasa dhatu and the doshas. Vata, so dry mucous membrane, scanty breast milk, scanty menses, generalized dryness means that there is an excess of vata in the rasa dhatu. Just say that out loud, an excess of vata in the rasa dhatu. This is how we're going to start to talk about things. Yeah, an excess of vata in the rasa dhatu. And then in pitta, if we have an excess of pitta in the rasa dhatu, we're going to have burning or inflamed membranes and heavy menses. Okay. If we have an excess of kapha in the rasa dhatu, there's going to be too much mucus, too much breast milk. And so this is how we know that there is an excess of the dosha in the rasa dhatu. Okay. This will make more sense as we keep going. And let's take a look at the Raktadhatu. So Raktadhatu is your blood. On a physical level, it provides oxygen to the cells, allowing them to breathe and preventing decomposition. A lack of cellular oxygenation is linked to numerous diseases, including cancer. We understand that. But the element here is fire. So the pitta, that fire element, is so closely connected to the Rakta Dhatu, the Rakta in the blood, and it's the carrier of heat in the body. So when blood is present in sufficient quantity, we have an abundance of vital energy. It gives us faith, love, and compassion. So Rakta literally means that which is colored red. So anytime you see Rakta, you can think of blood, you can think of red, you can think of warmth. Blood is similar to pitta in its qualities and in its function. So blood is the vessel, while pitta is the content. And the difference between rasa and rakta is rasa consists of plasma and lymph and white blood cells, and rakta is the red blood cells. So here we have the platelets as well, and it promotes oxygenation and coagulation. So this is the difference between rasa and rakta. So rasa is the plasma, the lymph, and the white blood cells, and rakta is the red blood cells and the platelets, and promotes the oxygenation and coagulation of your blood. So this right here is Rakta. The emotional function, and I love this word, Jivana, and it's promote vitality or a sense of life. When blood is present in sufficient quantity, we have an abundance of vital energy. So the location of Rakta is the liver, the spleen, the vessels. In Sushruta Samhita, which is one of the main texts of Ayurveda, if you remember from our philosophy module, um, it associates Rakta with the skin as its seat of manifestation. And so blood provides color both literally and metaphorically, the color for life. So if we're missing that joie de vie or that color for life, then we want to take a look at the Rakta. And when we look at Rakta in its relationship to the doshas, if there is an excess or actually a deficiency here, so of Rakta Dhatu in Vata would be present, and you've got cold, fatigue, and anemia. Okay, so if there's an excess of Vata, then you're going to have cold, fatigue, anemia, right? If they because Vata is actually moving in and moving around too much, making it fatigue and cold and anemia. So that's the excess of Vata in the Rakta Dhatu. If there's an excess of Pitta in the Rakta Dhatu, it's too hot, too intense, overheated liver and spleen. And if there's an excess of Kapha, kind of hard to determine from the Rakta Dhatu, Vata in the Rakta Dhatu, but you've also got cold and lethargy. I want to talk to you a little bit about the difference between fatigue and lethargy. So lethargy is that kind of blah, like it's like you could kind of define it as a blah where you're not motivated to move. There's no motivation. Fatigue is tiredness. Do you understand the difference? So it's not a lack of motivation or want of movement. It's just that you're so exhausted and tired that there's no energy to be spent. Whereas lethargy is that, no desire or that like stuck static energy. And so sometimes we have to ask ourselves, am I lethargic or am I fatigued? Because if you're lethargic, then you might want to add in movement. Have you ever done that? Been so lethargic, gone for a run, gone to the gym, you come back, you feel great because you shifted the movement. But in fatigue, if you do that, you won't, you'll go and move and you probably should have rested. So really understanding for yourself first and then for your clients, the difference between fatigue and lethargy will be very important for you understanding this idea of Vata and Kapha in any one of these dhatus and also in the mind. So we'll continue to talk about that and look at the difference between fatigue and lethargy as we move forward in these slides. Any questions so far on the Rakta Dhatu and understanding how this is an excess of the dosha in the Rakta Dhatu? Okay. Oh, I see there's one question in here. Oh, Harmony's like all the time, movement is my medicine. Yes, yes. How many I've decided, and I agree with her, that movement is the fourth pillar of life. That back in the day, I think we had this conversation. How many I had this conversation last week? We were talking how back in the day, like there was so much movement because they had to work. You weren't sitting at a computer. There wasn't a lot of like jobs that we were just sitting, and now we have that. So we've decided that modern medicine means movement as that. And Harmony's saying yes. She's on her movement machine, so she doesn't want to bob up and down. Hi. Um, So, very good. All right. So we're going to move to the next slide. And the next slide is MUMSA. So with MUMSA, we are talking about the muscles. So muscles act like this gelatinous layer that covers and strengthens the entire body structure and promotes action and work. Um, and its element is earth, fire, and air. So earth is the muscle mass, fire is the metabolism, and air is that contractility that happens. So back in the day, we would do a lot of like, contract and tensile activities, and this is where you can really feel the elements in each one of those. Like if you're lifting a weight, you can feel the muscle mass, the metabolism, and the contractility of the muscle itself. When our muscle tissue is deficient, we lack cohesion and structural integrity. In sufficient quantity, we have courage, confidence, strength, as well as an openness, forgiveness, and happiness. One of the first things I do with people who are suffering from depression, or a lack of confidence, or have been going through emotional heartbreak, one of the first things I'll have them do is start lifting weights. Because as the mind gets strong, so does the heart and the body, and that's often what we need. Especially as women, um, we need that to feel that strong again. We need to come back to our inner strength, and lifting weights allows us to do that. There's a few things I never underestimate, and one is the strength of lifting weights, which is but movement as well. But the other is also. Um, I ask people, tell me the state of your bedroom. Tell me the state of your kitchen. Tell me the state of your home. What is what is your surroundings like? Is it organized, or, is it a little um, vata vitiated, I like to call it. Because sometimes all we need to do is clear our space. If people aren't sleeping and their room is a mess, simply by cleaning up their room, they might have an excellent night's sleep. So I never underestimate the power of strength training and the power of people's environments and how it's affecting their mind. So those two things are something I always ask in consultation if I see certain patterns showing up. So we'll talk more about that in some of the other modules. But here we're talking about muscle. So the term mumsa actually comes from the root meaning to hold or firm. And so here, this allows us to come from strength. And from that strength, we're able to find, and this is on your slide here, openness, forgiveness, and happiness. And so again, like I said, a lot of times, women are, coming to me after divorce, and, they're heartbroken. And often what we're doing in Ayurveda is, yes, there is a physical manifestation of disease in the body, but often it's manifesting because of a heartbreak, because of grief, because of, so many different other reasons. So we want to look at the seat of and the root seat and cause of disease, which is, always remember, there's an element of mind to that, because every disease begins in the ether. It begins before it manifests. And if we can catch it before it manifests, or if we understand where it's manifested from, then we can really start to do some powerful work on levels that people don't even need to realize that we're working on. And that's where Ayurveda comes into play, where modern medicine, it really can complement modern medicine when the modern medicine isn't working. So in sufficient quantity, we have courage, confidence, and strength with the mums and muscles. And if we look at the next slide here, we can see that an excess, and remember, we're learning this language for a reason, all right? So I'm saying an excess of Mamsa Dhatu, an excess of Vata in the Mamsa Dhatu is poor muscular development and hypermobile, okay? And and when you've got hypermobility and poor muscular development, there's a strong connection between vata and the asti tissue, which is osteoporosis. So, and also in the digestive tissue and vata and the asti. So, if you've got like constant gas and dryness, then your bones are at risk as well. So, having that muscular development can really help with vata in the other tissues as well, because remember, they all move from one to another. So once we start to understand this relationship of the flow of excess vata in the tissues, then if there's an excess vata in the mamsa dhatu, then there is going to be an overflow of that into the asti dhatu, which can create more problems. So we want to make sure that we are looking at each one of the excesses of the doshas and each one of the dhatus so that we can ensure that there isn't an overflow and a relocation and a manifestation and a diversification of these doshas in the future tissues. So looking at an excess of pitta in the mumsa dhatu, you've got inflamed muscles, mitosis, and ligaments. Anytime you've got an itis, pitta is at play for the most part. Doesn't mean that there aren't other doshas at play as well, but if you've got an itis, then that means there's an inflammation. If you've got inflammation, you've got an excess of pitta. If you've got inflammation, you've got an excess of pitta for the most part. Um, Now, uh, with an excess of kapha in the mumsa dhatu, you've got an excess of muscle and hypomobile. So hyper means like hyperextension, moves too far. Hypo means that it's stuck, a little bit stuck in mobility. Okay. So here, you've got, you know, kapha people, they kind of move like this, right? They've got that like the mobility isn't there. They're stockier, and in their muscular makeup. Often bigger muscles and easier to develop, but then they don't have as much mobility. And so that's how you know that there is an excess of kapha in the mumsa dhatu. That's not to say that someone who has a constitution of kapha primarily has it. They obviously they've got a lot more kapha in their body. It doesn't mean that they're in imbalance. It just means that is their constitution. So we need to make sure that we apply things that bring kapha into balance to them. Just make sure there's no questions. Anybody have a question on this? No. Yeah, absolutely. Andrea's like 100%. That's always helped me when I feel blue and abs for core strength and life stability. Absolutely. So these are we're starting when we realize this, and it seems like, oh yeah, but I'm not applying, personal training, but you are like a lot of times what, just a simple saying, okay, you've got to go do weights twice a week, go for a walk 3 times a week, get out in nature. Like these are the simple life practices that we can do that can shift the energy in the body. It's not complicated. We don't have to do too much. Just a little is enough. And when we start to share that with people and they realize, oh, and then it becomes a lifestyle habit. So if they're going twice a week and then they're going 3 times a week, we want to start with small amounts so that we can create habits of a lifetime. So that is the Mamsa Dhatu and the excess of Vata Pitta Kapha in the Mamsa. So just kind of go back there. You can kind of see again, poor muscular development, hypermobile for Vata, Kapha, an excess of muscle, and hypomobile, and Pitta, any kind of inflammation on the muscles or the ligaments. Moving to meatus, the fat tissue. So the function of fat or adipose tissue is basically to lubricate. Sneha is the word for lubrication. It's also the word for oil, and it also means love. So I think I've talked to you a little bit about sneha being, like the Abhyanga self-oil massage means affection or love. So when we give ourselves an oil massage, we give ourselves a self-loving massage, and it lubricates and promotes a sense of layer of ojas over our entire body when we do our sesame coconut or sunflower or almond oil abhyanga. So it can provide a sense of sweetness and well-being. Its location is in the lubricates the muscles and tendons. And the meatus itself, the word meatus means that which is oily. So fat in itself is naturally oily. Um, and so this is the meatus in the fat tissue. We need a certain amount of fat to feel the sweetness of life. And fat mainly lubricates the muscles and tendons, but it also benefits other tissues such as the throat, the vocal cords, and it can promote melodious speech. Looking at an excess of Vata, Pitta, or Kapha in the Medas Dhatu. We look at an excess of Vata in the Medas Dhatu. We've got weight loss and dryness. Weight loss and dryness. If we have an excess of Pitta in the Medas Dhatu, we have cellulitis, inflammation of the of the fat, which is coming up a lot recent now too, and understanding that sometimes like what we think is cellulite is actually cellulitis. And so there's this inflammation of the lymphatic system, and we're not flushing as much as we could or need to. And then with kapha, an excess of kapha in the medas dhatu, you've got weight gain and oiliness. So these are your excesses of the doshas in the medas dhatu. And when we start to chart out pathology, you will look at this and you'll be like, okay, so what the symptoms are: weight loss, dry skin. So you're going to be like, okay, all right, there's an excess of vata in the medas dhatu. And this is how you're going to start to think. And then you'll learn from there what Shrosha and channel it's affecting. And then from there, what herb will come into play and what sensory therapies you're going to use because of the sense organs. And all of a sudden, this becomes super simple because you can see the relationship of the dhatus, the herbs, and the sense organs, and what's needed to bring the body out of excess and into balance. Let's look at the next one. And the next one is the asti, bones. So the main physical function here is to support all tissues, giving them firmness and solid structure. The emotional function here is dharana, which means to support. When present in adequate quantity and quality, they provide stability, confidence, security, firmness, and strong resistance. Location is obviously the bones. Asti provides support, stability, and firmness. The function of the bones is to basically, like I said, provide support. But we also want to know that the bones are closely the container of vata. All right. So vata resides in the spaces of the bone. So if you were to look at the bone, and there's actually air pockets in the bone, and this is what we're saying, that vata consists in there. And that's why there's such a close relationship between the bones and the digestive system, because vata is very much connected to the amount of air in the digestive system. So if you have constant gas and constipation, or mainly constant gas, then that air is part of your overall makeup. So we really want to understand that the vata the bones hold vata in the body, and the bones are the container, and vata is the content that resides in the spaces of the bones, and that porous, like if we were to the marrow almost, like even though that's closely connected to the nervous system, but there's that relationship between that space that creates that. So we'll go and explore this a little bit further, understanding that an excess of vata in the asti dhatu means that there is fragile bones and osteoporosis, crooked teeth, and hair loss. This is very important. It's such an amazing relationship when we really understand this, because we can see how important, like we can see how important our bone structure is. Pitta, here an excess of pitta, graying of the hair, yellowing of the teeth and nails, and bone inflammation. So any kind of osteitis. Um, and then Astidhatu, an excess of kapha in the astidhatu, excess bone growth, large teeth, coarse, thick hair. One of the things kapha have on all of us is this lush hair and nails that grow. They have that structure and that ability. So that is one of the attributes of kapha to take into consideration. I just double check to make sure there's no questions. There's not. So this is Asiddhatu, the bones, and the relationship of Vata and Asiddhatu, Pitta and Kapha, and why making sure that Vata in our digestive system is balanced, so that it can really protect our bones, because one of the symptoms of poor digestion and a vata imbalance in digestion is its effect on our bones. So moving to Maja, the bone marrow and nerves, I already spoke a little bit about how, obviously you've got the bones and then you've got this bone marrow and the nerves. So the main function here is to fill the empty spaces in the body, such as the nerve channels, the bones, and the cranial cavity. And so this Maja is ensures the secretion of synovial fluid and contributes to the lubrication of the eyes, the feces, and the skin. It's made up predominantly of water and earth, and it allows the passage of air. So here's that connection of marrow and asti. And there are two types of marrow, the bone marrow and the spinal marrow. So the bone marrow produces red blood cells, and the marrow and the bone tissue promotes a sense of fullness and satisfaction for life. So when deficient, we feel empty and anxious. So maja comes from the root word maj, um, meaning to immerse. And then just as bone marrow deeply penetrates the bones. And for this reason, Maja serves to anchor us. So if our Maja tissue is not in a healthy state, or we have an excess of Vata, Pitta, or Kapha, which we'll look at in a minute, we can have issues with our nervous system, in tenderness and love and compassion, and that softness. So let's take a look at an excess of these in each one of the doshas. So an excess of vata in the Majja an excess of vata in the Majja includes tics, tremors, and are very sensitive. Um, and an excess of pitta in the Majja means nerve inflammation, any kind of neuritis. And an excess of kapha in the Majja is slow responses, dull, not very sensitive. I was just in hospital with my daughter. Well, I've been in hospital a few times in the last few weeks, and she's been having seizures. And I've been trying to look at this from this standpoint, because she's having these seizures, and you are going between cardiology, and then neurology, and and like all the different departments. And it's interesting to me to watch. And each time, each one of them does the exact same test. I think I know how to give a neurologist tests and a cardiologist test. I've like done them like 50 times now. And I'm thinking to myself, okay, are these seizures, are they Vata, are they Pitta, are they Kapha? I actually can't figure it out. Neither can they. Got an MRI this afternoon. And I'm like, okay, like, come on, Ayurveda, let me know. And I actually think it's emotional. So that's my intuition is that they're emotional seizures. But like you've got to go through all the tests because you don't want to miss anything. And I'm really trying to use and understand the Maja Dhatu within and whether it's an excessive Vata. I think it's an excessive Vata and Pitta. But you know, because you can have a tridoshic, you can have a single doshic and a two doshic imbalance. So don't forget that's not just one. Sometimes it's multiple. But what we have to remember is that we always want to treat Vata first because we want to get the stability there. All right. So that's what I've been trying to do is just treat Vata for her on as many levels as possible. So you can start to use this wisdom in your own personal daily life, and alongside of modern medicine. And that's the beauty of Ayurveda and where I feel like we're actually going to be leading the way in understanding disease because we're realizing that just medication itself is not going to heal the root cause of disease. And that's where Ayurveda steps in and how important your role is going to be and helping bring this to the forefront of modern medicine. So, Maja Dhatu and the doshas is something I'm exploring deeply myself right now, based on my daughter's seizures. Um, so now moving to Shukra. And here we've got the main physical function of reproduction. And this is the reproductive tissue. The element is water. The emotional function is pleasure and inspiration. It promotes strength, energy, resilience throughout the body, supporting immune functions. The location is reproductive organs, sperm and ovum, and it enables the creation of new life. Now, remember, we're going through this whole cycle of tissue development. And next week, uh, we're going to be going through lesson 4. And in lesson 4, you're going to understand how you've got this amazing tissue production that actually happens. And here we look at Shukra as it symbolizes the seed, the woman's ovum, and the man's sperm, and all the reproductive fluids in general, such as the seminal fluid and the prostatic fluid. The element here is most refined water, and it's the carrier of creativity and sexual energy. So when it's insufficient, it causes a general lack of creativity and life, and more specifically, an impotence or infertility. So Shukra means seed, and luminous, and it also is the Sanskrit name for the planet Venus, which is interesting. So Shukra is slightly different in women and in men. It contains reproductive component in sperm ovum and a pleasure component. A pleasure component. So, well, in men, these two elements function simultaneously. In women, they do not. So it's different for men than it is for women. For women, sexual activity does not correspond to the release of ovum, but it activates other aspects of Shukra Dhatu. So, in that pleasure of orgasm, that creativity. We talk a lot about, especially even in our consultations, one of the questions is about our sex life because uh, pleasure, reproduction, sex is one of the pillars of life. So we've got, basically digestion and food, sleep, and sexual uh, pleasure or relationships. And you can look at that. It's like one of those parts of life where it's like, okay, so am I able to orgasm? Do I know how? And do I have pleasure with my partner? Is it because the relationship needs healing, or is it because I have a physiological um imbalance where I'm not able to have an orgasm? We also look at the idea that in different parts of our life we're not sexually active, and so are we able to have self pleasure, or are we able to have we made a decision to for that pleasure to be in different forms in our life? So really being open and learning to have those conversations around pleasure, around this idea of creativity. So sometimes I know for myself in different times of my life, especially when I was married for 20 years, all my creativity went into my business. I didn't feel like sex. And so like, but the creativity was still there. It was just being channeled into a business at that point in time of my life. So like you have different stages and different uh, arcs and peaks of sensuality, of sexuality, of creativity, of relationships, and how does that show up? And what do we do with this idea of the reproductive tissue? The monks are trained, the celibate monks are trained to actually take this reproductive tissue and this idea of creativity and shukra and take it up their spine all the way up to the crown of their head. And it's almost like a reuse of the shukra reproductive tissue in order to take that creativity and that life force energy and turn it into ojas, to turn it into prana. So that's why sometimes we can look at somebody's sexual activity and it can be actually too much, because what happens is then there's a disbursement of this energy that needs to actually reintegrate it into your body as a powerful force of creative energy. So this is a whole nother topic, but it's a really interesting one, because you might see in men and some women that they are having too much sex, which means there's too much output of this shukra energy, and it can create imbalance, just as it could be the other way as well. So, an interesting topic. It is so interesting, and also why sometimes, like if you haven't had intercourse in a while, or if it's and you do and you feel amazing afterwards, right? So it's like or if self-pleasure is so important. So don't underestimate the power of orgasm and healing, and reigniting uh, um, that sense of ojas and creativity in the body. Harmony's put in here, too much sex can deplete ojas, which is the kidney essence, which is so true. And that's exactly what we're saying. Is like we don't want to deplete the ojas. And ojas is the next kind of the next like uh, creation from this cycle of tissues. So when we go to the next slide here, we will look at, let's see here, can get that up. Maja, let me get my slides. Hold on one second, guys. Um, there we go. So the Shukra Dhatu and the doshas. So too much, an excess of vata, too much vata, an excess of vata is infertility and unable to sustain creativity. An excess of pitta dosha in the shukra dhatu is an inflammation of reproductive organs such as prostatis or endometriosis. And an excess of kapha dosha in the shukra dhatu is an excess volume of semen or sperm, swollen reproductive organs, and blockages to flow. This idea of a blockage in kapha is that stagnation. So anytime there's a block or a stagnation, you're looking at the kapha dosha. You'll start to pick up on these terms and understanding so that they become clues to knowing what dosha is at play. Pitta is always an inflammation. It's an itis. It's red. It's angry. It's hot. Vata is always about too much movement. And cold and dry. And kapha is that stagnation. And a couple more comments here. Good. Good, good, good. Okay. So, any questions around Shruka and this here?
Yeah, I had a question about how it's affected the shukra is affected with either menopause or hysterectomy. Um, like if I was to use myself as an example, I had a hysterectomy 2 years ago, and I take HRT, but it's still not enough. Like I'm losing sexual function, I'm losing that, you know, ability to orgasm, as like, yeah, that kind
Yeah.
of, yeah.
Yeah, so I would encourage an increase of creativity in other ways, and also doing a lot of Kundalini activating breath work, which would be super powerful. I may let Harmony, if she can jump on and answer the HRT question, because she will have a greater understanding of that than I will. So I'll let her pop in if she can hear this. Yeah, she can. Harmony,
Can you
thank
hear
you.
me, or do you want to turn this
Yeah.
off?
No, we can hear you.
Okay, just
Yeah.
walking. So with the like menopause or hysterectomy due to various reasons is a natural causation of the decline in the dhatus, and so this will naturally increase vata in those tissues, and that's sort of just like a natural decline that all women are going to go through. And HRT can support that to help rebuild the tissue, because we know when we lose estrogen, we will lose the lubrication. So we'll lose the kapha side of things. We will also lose some of the tissue itself. So the laborium minor and the excess of the vagina actually can shrinken down as well. So having that estrogen can support sort of like engulfing the tissue, so to speak. Um, and so we really need to be mindful that if dependent on your age, if you have been put into either a surgical menopause or gone into menopause, you're moving into that vata phase of life. So really having to support vata as best you can is the way that you're going to help with the Shukta Dhatu. And so when it comes to HRT, do you feel that your HRT have they used your labs to support the correct HRT amount?
Yeah, I think the one that's lacking for me now is testosterone, and that
Oh,
seems to be the
there
part
you
that
go.
has impacted me sexually the most.
100%. Yeah, absolutely. So the testosterone is in charge of your libido. So maybe looking at being able to support your testosterone. And then are you using any Ayurvedic herbs to help support that as well?
No.
No. So
Maybe she.
generally we talk. Oh, where'd I go? Can everyone see me? Oh, I did something. I clicked something. Um, we speak about Shatavari for women, and that helps with sort of more of the estrogen side of things. But when we're looking at testosterone, I really like Shilajit, which also is building, tissue building. And so Shilajit can be a really good supplement to support that, as well as, the most common one everyone uses, ashwagandha, only because ashwagandha does not only improves your iron levels, but it can also improve, it's meant to be the male tonic, even though everyone uses it. So Shatavari is the equivalent to the male tonic. So it can boost natural testosterone, but I personally like Shilajit if there's sort of any tissue depletion, energy depletion, that kind of stuff. So there's those type of things. And then as Jasmine said, finding ways where you can increase your creativity, and it doesn't necessarily mean to be in a sexual way, because Vata governs creativity. And so if we're lacking Vata, is this really annoying me talking while I'm walking? Because I can't stop it. You okay?
No, you're fine.
Okay. We can definitely increase our creativity in other ways and find joy and pleasure in other ways, which sometimes naturally will translate into the bedroom. And we actually ran this really beautiful workshop at the Goddess Retreat the other weekend, and we spoke about using the goddesses to call upon to embody their essence. And Lakshmi is the goddess of abundance, sexuality, create well, all of those sort of womanly aspects. And so doing a few different kind of meditations or mantras, or even just like working and understanding Lakshmi, because she's not out there, she's part of who you are. And so calling in that Lakshmi essence, if you are feeling like, okay, I really want to increase the libido, and I know there's some physiological functions that, are a little bit depleted, making it more hard. What can I do externally or internally? And that could be to just make yourself feel really beautiful, dress up really beautiful, do the abhyanga, the sneha we learned, is self-love. It's like giving that sort of love back to yourself. And then if there's any sort of drying down in that area, you can do some oleation. So massage of the vagina with some beautiful oil as well, like not perfumed oil or anything like that though. So there's different rituals that you can do to help promote that sort of feeling of libido. Does that answer your question?
Yeah, that's really helpful. Thank you.
No worries.
Thanks, Mom.
I'll turn my bobbing head off now, guys. I'm very Peter Vada. I'm always be moving. I'm like,
Love it. Thanks, Harmony. That's great. So I've written those herbs down for you. So Shilajit was the one that increases testosterone, often used for males, but women can use it as well. I use it when I need to increase my energy. Ashwagandha, and Shatavari. I prefer Shatavari as a female, but ashwagandha can be a good one from a testosterone. But Shilajit, it's expensive, but it works. So I actually have some here, but it's really gooey. You can get it in rock form too. The gooey stuff's better.
I
So
actually did. My husband had low testosterone for a while because he was overtraining, and I put him on the Shilajit, and it worked. It worked wonders. Problems there anymore, except for the wife running away.
love it. Oh my goodness, life. So good. There's a few comments here. I'm sure that there's some people love this having never but spoken about libido and menopause from a perspective before. Amazing. Thanks, Andrea. Um, so that's this part of it, and we're actually looking at Shukra Dhatu here. So and it's so powerful. It's such an important part of our life. And the beautiful thing about Ayurveda is that it continues to allow us to look at that. So now we're going to move into the Dhatu dosha and subdosha relationship examples. So here, I'm just going to get rid of this real quick. There we go. So here we have, like if we look at weight gain, so Avalambaka Kappa in the Metis Dhatu. So remember how I was saying, like, okay, you've got your Kappa in the Metis Dhatu, weight gain so now we're going to look at the relationship of the subdosha, the dosha, and the dhatu. So if we have weight gain, we have an excess of kapha in the metis dhatu. Not only do we have an excess of kapha in the metis dhatu, but we have avalambaka kapha, which is the location of kapha in the metis dhatu. The reasoning is one function of avalambaka kapha is to cling or to hold on to. In this case, weight is holding on or clinging to the person, and the lungs are also a storehouse for kapha in the body. So associations may be based on the location or function of the dhatu. So when we look at this, we're looking at, and I just want to make sure that got moved here. Sorry, guys, I'm just going to move through here. Shukra, and we're here. So now we're going to really look at these relationships. And as we move forward, you're going to understand more. And like next week, we're going to look at um, this continued relationship of the Schroeters as well. So if we have an excess of Vata in the Rasa Dhatu, what do we have? We have dryness in this channel. Okay. So that moves, and so dry membranes, which are Vyana Vayu, because Vyana is that feeling of circulation throughout the body, has entered in the Rasa Dhatu, which is the dry membrane. So reasoning, location of Vyana Vayu is always associated with the mucous membranes because they are throughout the body. They respond to circulation of plasma or water from the center to the periphery. Exceptions can be dryness in a channel that moves downwards, such as the large intestine and menstrual and urinary tract, which and the direction is more important than the location for Vata dosha. So it's okay to declare that both are involved. So for Vata, direction of flow is most important. So here, for dry membranes, we have an excess of Vyana Vayu or Vata in the Rasa Dhatu. So all of a sudden, we're starting to see this relationship of the dhatus, the doshas, and the subdoshas. I'm going to move us from here to our homework because from here, I'll be able to show you kind of like what's going to be expected of, and guys, can you guys see this? The homework? Yeah. So I'm going to give you the key in a second, but this is kind of the homework for level one. And I highly encourage you guys while we're doing these lectures, like to start like working on the homework, you write out your if it works for you, you don't have to. But like you can work on uh your flashcards if you want to. But we're going to look at, I might just pull up the homework key. So we're going to look here at like the 20 attributes and why they're important for the practitioner. But before we do that, I wanted to come down to this chart so that you can see the 7 dhatus. Okay, so you've got rasa, the predominant element is water. You've got the tissue association, which is the plasma, the lymph, the child, breast milk, menstrual fluid. Here we also have an excess in the dhatu, means nourishment, swelling, mucus placement, and then a deficiency in the dhatu is malnourished, dry, and dissatisfied. All right, so you can kind of see you've got an excess and a deficiency. In the Rakta, you've got fire as the predominant element. We talked about this. We've got blood, liver, spleen, and the blood vessels. An excess in the dhatu means intense anger and fever, and a deficiency in the dhatu is cold and fatigue. In the Mamsa dhatu, we've got earth, and here we've got the tissue association being the muscles. Muscle bound, stiffness, overly confident is an excess in the dhatu. And then a deficiency in the dhatu is muscle wasting, weak musculature, cowardice, and insecure. And then for medas, we've got water, so your fat, your omentum, and your peritoneum. And here we've got an excess in the dhatu, obesity, excessive sweat. And then a deficiency in the dhatu is cold and dry skin, dry hair, dryness. And then for asti, which is earth and air, you've got your bones, your nails, your teeth, and your hair. And then an excess, which is really an excess is kapha, is bone spurs, bone cancers. And then the deficiency in the dhatu is fragile bones, fragile nails, crooked teeth, which is an excess of vata in the dhatu. You can see how it like strips away, like the quality of the element is either deficiency or a excess. So with the Maja, we've got predominant is water and earth. Here we've got the tissue association of the nervous system and the marrow and the sclera. Sclera is the eye, white. And then the excess dhatu is the sluggish response and depression. The deficient dhatu is tremors and nervous system. And shukra, we just talked about this. Water, we call it refined water. It's like that refined water of life, sperm, semen, ovum, ovaries, prostate glands, and fluids. And enlarged prostate and ovaries, low sperm motility, high sperm count is an excess in the dhatu. And then a deficiency in the dhatu is low sexual desire, infertility, low sperm, and low sperm count. So these are the 7 dhatus, and this is one of your homework questions. You might want to screenshot this or take a picture with your phone. Then you got the answers. So this is the 7 dhatus and the element that is predominant in each of the dhatu and the tissues associated with each of these dhatus, and one example of an excess or a deficiency in that dhatu. Okay, so all of a sudden it's starting to come right. Your insight homework is going to be for you to look at your own body and how you feel. Describe yourself in terms of the 10 pairs of opposite qualities. You're going to understand the qualities inherent in your body, which dosha appears to be most dominant, and then describe one symptom that you are experiencing in terms of doshic imbalance. So you're basically going to be looking at yourself in this way. And with that, you can see here in your practical projects, we're going to continue in your meditation practice and be consistent and write in your journal once a week about your experience of meditation. Again, it could just be sitting for 5 minutes. It doesn't have to be a full 30, doing the Soham meditation, doing one, even just sitting in silence, allowing whatever to arise. You'll have more meditation practices as we move through the modules. Add all new Sanskrit words to your flashcards. And then from here, we're going to start to chart out the symptom, the dosha, the subdosha, the dhatu, and the excess and deficiency. Is it deficient in that dosha or is it an excess in that dosha? All right. So the following examples is of cold hands given below using a chart, right? Describe each of the following in terms of the involved dosha. So you've got cold hands as your examples, and then you've got all these other ones as ones that you have to look at. Again, if you want to take a screenshot of this, you're welcome to. So here, cold hands was the example we gave you. Dosha is vata because anything to do with cold often has to do with vata. Vyana because of circulation. The dhatu, rakta, right, because of blood and the flow of blood, and its deficiency, okay, of vata in the vyana of the rakta dhatu. Now, muscle cramping is a vata dosha issue of udana because udana subdosha is connected to mamsa dhatu. So always an expression as well. So it's you'll learn this as we keep going through, but muscle cramping and anything to do with muscles has to do with the udana subdosha of vata and it's located in the mamsa dhatu, and it's deficient. And then joint pain without inflammation. Remember, that's pitta. If it was inflammation, pitta would be involved, but joint pain without inflammation is actually located in that. Just ignore udana. It should be apana located, and it's connected to that asti dhatu. Because remember how I said that digestion, look at that. The digestion is connected to the asti dhatu. Now, if this was joint pain with inflammation, you'd be looking at pitta. Okay. So diarrhea is pitta in the pachaka subdosha, which is located in the digestive tract, and the rasa dhatu, and it's deficient. Constipation, vata, and apana, because apana is the location, the down and out rasa and is deficient. Sluggish digestion is kapha in the clay daka, which is part of the digestion, in the rasa dhatu in excess. So we always want to start in those rasa dhatus, and then weight loss is vata connected to samana, which is absorption, and dhatu is metis and it's deficient, and then weight gain is avalambaka kapha, and it's an excess of that in the metis dhatu. So this right here is how you're going to start mapping out the dosha, the subdosha, and the dhatu, and understanding how each one of these are either excess or deficient and what would need to be done from there. We're going to keep layering onto this chart to the point where it ends with the herbology and the sensory therapy that you would be using. So just hold this idea, and by the time we get to the next homeworks, you're going to be mapping this out in a way that you'll understand each symptom, each dosha, each subdosha, and each dhatu. Give it time. You're not going to know it right away, but the whole program is set up so that you can do that in a powerful way. Here, and I'll post this next week, but here you'll see the basically like the describe two symptoms of each of Vata, Pitta, and there. So you'll be doing that. But Kapha is weight gain, chest congestion, excess mucus. Pitta is fever and burning sensation or anger. Vata is pain and coldness. For the subdoshas, you've got your movement, direction of movement for Vata, and then you've got the locations and the digestive action for each one of the Pitta subdoshas. All right. And then from there, you've got, and all of this is in the notes, but there you've got also got the lubrication action for Kapha subdosha. All right. So these are, and I'll post this on and put this on the Facebook page. But this will be the homework that's coming up that will be due beginning of next week. And take your time, take a look at this, understand that it does take a moment to layer on, but we're going to come out the end of this knowing what herbs, what sensory therapy, what dosha, what subdosha, what dhatu, and what shrota we're going to be working with. It takes a moment. Give yourself time, don't get overwhelmed. But this is the principles of Anatomy and Physiology 1. And next week, Harmony will be taking you through Anatomy and Physiology 2 in lesson 4. And we'll be layering on to this approach where we're learning to understand the doshic imbalances in excess and deficiency in each one of the dhatus and subdoshas. Okay. Any questions? There's one here. Harmony, did you want to add anything onto that for a moment? So we're going to finish a little early today because I feel like we're at a really good stopping point and we've covered a lot of information. Maybe use these next 15 minutes to do your Sanskrit cards or start on the homework. We're tracking really well. Christina, yes, you have a question.
Hey, I noticed that there's a couple questions in the chat regarding where to purchase goddess statues and then also Ayurvedic herbs. I was wondering if you could answer those.
So I'll put some links to the goddess statues. I think that some of them are, for me, a lot of mine are American contacts. I'm not quite sure where in Australia, and Harmony might know better. But I mean, you've got to ship them from somewhere. So I'll give you my contact for like say for these ones. Like this company here is called Lotus Sculpture. Yeah, and I'll type that up for you. Um, and they're located in California. Um, So that's a really good one that I know right off the bat. Also, if you travel to like Bali and places like that, a lot of the shops in Bali have some really good statues as well. Uh, and if you come to India next year, you'll be able to get them there. Hold on one second. Someone's putting in. Oh, you get yours from the same place, Harmony, as I put. Yeah. So
I
this place
get
in.
mine from Bali.
Oh, you get yours from Bali.
Yeah,
Okay.
I think all of mine have pretty much come from Bali except for one, maybe one's come from India, and I got it off an Indian site. I think the Distacart.
Okay. I'll put this Lotus one up here. I don't even know if they're still in business, but and also lotussculpture.com. Um I think there's a few places on Etsy too that sell them. But yeah, I think Bali's probably for Australians, Bali's probably the best bet.
And we're doing our ISO Vedic breathwork and meditation practitioner training there next year in June. So come along and get yourself a statue.
Um, Beautiful. And then the other question was Ayurvedic herbs. So, in there is iHerb, um, which you can purchase online. So the iHerb, and they have most of the Ayurvedic herbs like Shilajit and things like that. Harmony, do you and Harmony saying Distacat? Is that for the herbs as well? No. Sattvic Health.
They're
Yeah.
both. So Satvik is in Australia. They're the only supplier of the biobotanicals herbs. Um, they always seem very low on stock though. And Distacart takes ages because it comes from India. So that's, but I actually sent one to you, Jasmine and Helena, this morning, be saying that, asking if any of you have ordered from there. So I haven't ordered from there, so I'll check it out.
I'll check it out. Yeah, amazing. Yeah, that is that those two there. And then Banyan, if you go into Amazon too, Banyan, you can purchase Banyan botanicals through Amazon. It's expensive, but they are available on there.
I get the Shilajit from Dista.
Yeah,
Yeah,
beautiful. I haven't heard ordered from Herberon Essentials.
either. I think is that who I put. I was looking up herb cottage the other day for loose leaf herbs, but I don't know. Not tried it. So
Uh, there's also I really love it's actually the mushroom company. They have ashwagandha and I think shatavari, but that's about it. But I love the quality of their product, and I know the owner of that company, and they're really good.
Monica, so Michelle did her training through here, and she owns a supplement country supplement store, and she has Shilajit, and she has ashwagandha and a whole lot of different powders, and also there's that Sony Health who does the one. Well, she only does two blends,
Yeah,
but the chocolate one is so good. It's got ashwagandha, it's got brahmi, it's got a whole lot of Ayurvedic herbs.
perfect. Yeah. Any other questions, guys? No. Well, if you do think of anything, please feel free to put it on the Facebook page, send us a message. Look forward to reviewing your homework next week. And Harmony, we look forward to learning from you next week as far as lesson 4. And we are moving along this journey to a place where we'll soon be charting out pathology, which is kind of exciting. And also understanding the sensory therapies that go alongside of that with the herbs and nutrition. So that's where we're heading, and that's where all of this leads to. It's pieces of the puzzle. It's understanding, the cellular nature of Ayurveda, to the more structural nature of actual practices and daily rituals. So super excited about this journey. You guys are amazing. Let's close with a single just allowing the information to land in the center of the heart. And any amount of gratitude to flow through. Exhaling completely. Inhaling. Om Shanti, Shanti, Shanti. Peace, peace, peace. Namaste. Thank you guys. I'll stay on if there's any individual questions, and have an amazing weekend. Mhm. Thank you. Thank you. Hey, Emma, I can't hear you. Okay.